Good day, everyone. Our topic is all about leishmania. So the reporters are as follows: Zon Kais Hapay, Johaira Kalipa, Kate Gumiran. So what is the name of the infection and the parasite? So the name of infection is Leishmaniasis. Name of the parasite is a protozoan parasite from the Leishmania species. So now let's proceed to the life cycle of this parasite. The cycle begins with an infected sandfly. It will inject promastigote stage into the skin of the human during its blood meal. As this promastigote reach the puncture wound, will be phagocytized or ingested by macrophages, or also known as white blood cell, that kills the and protects our body from unnecessary foreign microorganisms. Promastigotes transform into amastigotes, which multiply by simple division and proceed to infect other mononuclear phagocytic cells. Parasite, host, and other factors affect whether the infection becomes symptomatic and whether cutaneous or visceral leishmaniasis results. At the fifth step, sandfly will become infected by ingesting infected cells during blood meals. Within the sandfly, a mastigotes that is transmitted from the infected person's body will transform into promastigotes and develop in the gut of the sandfly. It will migrate to the proboscis and the same cycle will repeat.
Source of infection: Leishmaniasis is due to protozoan parasites from the Leishmania species. You get the Leishmaniasis from being bitten by an infected sandfly. The parasite lives and multiplies inside the female sandfly. Mode of infection: the natural route of infection in Leishmaniasis is the skin, which contains unique cells such as dendritic cell and Langerhans cell with a potent immunomodulatory effect. Pathogenesis: after inoculation by sandflies, the flagellated promastigotes bind to microphages in the skin. Two of the parasite surface molecules appear to play a prominent role in parasite-phagocyte interactions. The extent and presentation of disease depend on several factors, including the humoral and cell-mediated immune response of the host, the virulence of the infecting species, and the parasite's burden. Infections may heal spontaneously or may progress to chronic disease, often resulting in death from secondary infection. Promastigotes activate complement through the alternate pathway and are opsonized. The most important immunologic feature is a marked suppression of the cell-mediated immunity to leishmanial antigens. In person with asymptomatic self-resolving infection, T helper Th1 cells predominate with interleukin-2, IL-2, interferon gamma, and IL-12 as the prominent cytokines that induce disease resolution. Although immune suppression years later can result in disease, an overproduction of both specific immunoglobulins and nonspecific immunoglobulins also occurs. The increase in gamma globulin leads to a reversal of the albumin-globulin ratio commonly associated with this disease.
And symptoms. There are three types of leishmaniasis: the continuous, visceral, and mucosal. For the continuous, it characterizes the skin sores, and people can develop multiple sores and swollen glands. The sores can lead into scarring and infections. For the visceral, this is more severe and affects internal organ, usually the spleen, liver, and bone marrow. It can cause fever, weight loss, anemia, and enlargement of the spleen and liver. And for the mucosal, this is less common and destructions of mucous membrane, which is the nose, mouth, and throat. Sometimes it can be a consequence of continuous leishmaniasis. Treatment and prevention control. For the treatment, there are many types of medications enabled to treat the disease. Which one to use, it depends person type of disease and severity. Treatment medication for leishmaniasis: cryotherapy and thermotherapy, parmomycin ointment or antibiotic ointment, intralesional pentavalent antimony, oral miltefosine, IV pentavalent antimony or amphotericin, IV paramomycin, oral azelaic, and IV fentanyl. Prevention and control. This can be done by vector control, personal protection, severe treatment, residual spray, space spray, topical repellents, and avoid sandflies. Avoiding being bite by the sandflies, this can be done by using insect repellents and insecticide treating bed nets, wearing appropriate clothing to cover the skin, and avoid outdoor activities with the sandflies are more active.